Vikram, welcome to Sri Lanka again.
Thank you, Athula. It's a pleasure to be here.
Thank you so much for agreeing to be interviewed by our IRD colleagues while you are at the Science to Tackle Non-Communicable Disease in South Asia and Beyond the SDG era, the conference organized by the Academy of Medical Sciences. So I know this is lunchtime. You were generous to give 15 minutes. So my colleagues are actually interested in having a discussion with you based on your expertise. Your thoughts about the global mental health in relation to that, the priorities for South Asia and Sri Lanka with your experience. So
Athula, of course, you know the priorities as well as I do, being one of the leading researchers in South Asia. I think for us, the priorities must be guided by the SDGs. And by the SDGs, I mean not only the health SDGs, for which you have mental health represented, for example, in SDG 3, and the target on improving mental health, promoting mental health and well-being, preventing substance use, and universal health coverage. But in fact, I think mental health is also very relevant in some of the other SDGs, for example, on gender-based violence and on education. And so we need to define our mental health research priorities both within the health goal as well as in the non-health goals, because for us, mental health must be seen as a cross-cutting issue and not purely a health or disorder-related concern.
Thank you very much. So, taking it further, we had this mental health group discussion yesterday. Can you reflect on some of the things we discussed? Because at the end of the day, I think it's important we carry the message and have a local impact and a regional impact. So
let me illustrate examples of both health and non-health, mental health related research priorities. Within the health SDG, examples of research priorities would include how do we improve the quality of mental health care for people with mental health problems that reflects the evidence. For example, we know that psychological and social interventions, when delivered by non-specialist workers, are highly effective. The question for us now is, how can we scale these up at a mass scale rather than just have these pilot demonstration projects and trials? Another important question would be, how do we improve the quality of inpatient care so that the historic injustices in terms of violence and coercion that people with serious mental illness have experienced can be removed once and for all? And relatedly, how can we provide long-term supported care for people who have enduring mental health problems and disabilities? So those are examples, I think, of within the health goal, what are the kinds of research priorities. But outside the health goal, I think, for example, prevention lies completely outside the health goal. And a key element of prevention would be, for example, how can we reduce gender-based violence? And when gender-based violence occurs, how can we mitigate the effects of gender-based violence on the woman's well-being? How can we address violent behavior in men using both structural interventions that address patriarchy, but also interpersonal interventions that help promote healthy negotiation, conflict resolution skills in couples? Another big area for me, I think, would be children and adolescents. As you know, one of the most important risk factors for poor mental health is adversities in childhood and adolescence. And I think a very important set of research questions are around how do we build nurturing environments at home and in schools that can be promotive of resilience, of mental health overall, reduce the risk factors for mental illness, and provide pathways for early detection and then referral for children and young people who are developing mental health problems.
So Vikram, knowing Sri Lanka reasonably well and putting in context of South Asia, who do you think has the main responsibility in taking this agenda forwards?
I have no doubt that it's a multi-stakeholder response. It's not one group. In the research ecosystem, we need to recognize, first of all, the role of government, because government has to value research. It has to say that policy making is going to be guided by science. If you don't have that statement, then the research we do is really primarily not going to remain, it's going to remain within journal articles. It's going to have no real impact at the population level. So government is very important, both for accepting the importance of research and then backing it with funds. I feel in our region, we should be increasingly independent of international and Western funders only. I think they're important, but we cannot be solely reliant on Western funders. We must have our own domestic funding arrangements, and I think the government is very important. Secondly, I would say the mental health professionals, particularly those who are clinicians, to help generate and utilize research findings. Third is the research community, which of course is not necessarily clinical. professions like epidemiology, statistics, and so on. We need a full engagement of the public health research community in the research agenda. And the last is people in the community, civil society, people with a lived experience, their carers, and the broader community that can both canvas for research, but also canvas for the utilization of research findings in policy and practice.
Thank you, Vikram. So you also know about the IRD, Institute for Research and Development, which we brought up over the last 20 years. So knowing that, showcasing IRD's work, because I'm asking you as external expert globally and regionally, what are your reflections on how people outside IRD in Sri Lanka learn and, from the IRD work and the difficult path we went to expand the research culture in Sri Lanka as well as outside?
So, a couple of observations about IRD, which of course I am a great admirer of. I think the most important point to make about IRD is that it shows how you can merge both basic science with clinical and public health science. So the idea that these are separate disciplines of research, IRD has shown wonderfully how, in fact, one informs the other. And the most comprehensive approach to mental health research must be one that embraces both the basic sciences like genetics as well as clinical and public health sciences. The second thing that IRD shows, which is common to most of the research institutions in mental health around South Asia, is that some of the most innovative work is happening outside the formal medical school sector. And in part, that is because these organizations that are outside the medical school sector are more nimble, more flexible, and most importantly, much more community-based. And so if you look at Pakistan, you look at India, you look at Sri Lanka, much of the real high-impact research that's happening is coming from these sorts of institutions. In India, we call them NGOs, which mean different things in different places. But much of the public health work in India, not just in mental health, by the way, including HIV, TB, maternal and child health, some of the innovative work is happening in NGOs. So looking forward, what I believe we should be doing in the region is creating research partnerships between these community-based organizations with the formal university medical school sector, which can be mutually beneficial. But also to do that, the government must recognize that these organizations are an asset to the nation. And that means translating words into action by investing hard money in supporting careers, in supporting the research faculty of these organizations so that they develop long-term trajectories and are not just constantly working in short-term project mode.
Thank you. From my last question, what is your message to early career people becoming future research leaders?
Don't give up. I mean, you and I know, Athula, we've had a lot of knocks in our earlier years. Today we can sit here and we can pontificate about this, that, and the other. But the truth be said, 25 years ago, when you and I were in exactly the same stage of our lives as any early career researcher today might be, we were struggling. And we took a lot of rejections, and we took it personally, and we were very sensitive and very hurt, as I remember myself. I would say this is part and parcel of a research career development. You will face a lot of setbacks. Be prepared, because what you're doing here is you're pursuing an unconventional life. If you want a conventional life, become a doctor and work in the hospital. And that can be very rewarding and a lot of fun. And I'm not dismissing that. I'm saying that's a very important and valuable career. But if you do research, you're doing something unconventional. You're doing it because your mind is curious and you're doing something to pursue something that's intellectually satisfying. But the price of that is that you're taking a risk. So be prepared to take risk. And the second really important thing I would like to say is find a mentor. You and I had great fortune. We shared the same PhD guide, and how much we owe that individual, Anthony Mann, for what he did for you and me. I think that same lesson should apply to the early career researchers today. Find a mentor who can be genuine, authentic, supportive, and give you the kind of guidance that you need.
Thank you very much, Vikram, for sharing your experience and expertise and giving this message to the whole South Asia. Thank you very much.
Thank you, Athula. Thank you very much.